Today's patient, RH, is a 60-year-old guy who was really losing his hair, mostly in this frontal area. So he really wanted to restore his hairline. His hair is silver with a little bit of, darker pigment, like a salt and pepper in it, which presents a special set of problems when you're doing an FUE because you have to actually visualize each hair. But it's also very interesting. So we are able to dye each hair so that we can kind of see where it is. You can use a couple of tricks for polarizing the light or using the shadow of the light to avoid glare and get to really see the hair. And when you're used to doing FUEs of this type, you get to know all the little tips and tricks of the trade, which is why it's particularly important if you have gray or silver or salt and pepper hair to pick somebody who has a lot of experience in these kind of things. This patient is what would be considered a Norwood 3AV. So he has some hairline recession that kind of goes back not only in the corners, but right here at the frontal forelock, and he has some recession in his crown. Now the crown is not his main focus. He's 60 years old, so a little bit of crown loss looks normal on him, but he would really like to have his primary goal be to fill in his hairline today and reframe his face, and his secondary goal be to fill in the crown. Now normally if somebody's not on finasteride, I won't fill in their crown because I don't want to leave them a little island of hair surrounded by a moat of hair loss as his hair loss progresses. But he's on finasteride and doing very well, and the crown has stabilized, so we're probably going to add a little bit in there today. Our goal today is between 22 and 2,500 grafts. Usually a normal FUE, even for the most accomplished surgeon around the world, if you want to preserve the donor area, it's going to be somewhere around 2,500 grafts. The other thing that always gets asked that I find is a really interesting question is the question of whether or not I can transplant only the darker hairs. The trick is that when hair actually grays or turns white, what happens is the hair doesn't grow in as a single hair. Usually hairs grow in tiny little clumps called follicular units. That would be the equivalent of a graft. And hairs actually have 1, 2, or 3 hairs in each little clump. And the way, if you had like a 3-hair clump, the way that the hair will actually gray is only one of those hairs will turn white first, and then the other 2 will stay pigmented. And eventually that second one will turn white, and then the third one will finally turn white. But usually what you're dealing with is a little mix. And so you can't just transplant the darker pigmented hairs. You have to actually transplant them all. Even though you can't select out the individual darker pigmented hairs, you can actually have everything grow in just beautifully, naturally. It just blends perfectly. When I first started in this business, I thought to myself, oh no, how am I going to make this, perfectly blend? But you actually don't have to worry about that too much. It actually just does it naturally on its own. Another thing about this patient, he has very fine hair, and his hair actually is more in those little clumps of 3s and 4s than some other patients. So he doesn't have a lot of single hairs. He has a lot of little tiny clumps. And so you have to be able to adjust on the fly for what constitutes a follicular unit. On a graft by graft basis, we are assessing whether or not one of those hairs is actually transected. And the reason we're so anal retentive about this, and we count every single graft, and we look at every single graft under the microscope, is because without that, we won't know what to expect for our growth. Now today we're having single-digit transection rates, and we know exactly what our rates translate into for our growth, but this is one of the reasons that FUE might, in some other hands, might have a less than stellar or less than optimum growth pattern. And the other reason that we do this is so that we know our own performance and can adjust on the fly. Maybe the angle has changed, the angles of hair change all around your head, and we want to make sure that we have the lowest transection rate possible.